Ladies and gentlemen, we have amidst us one such exceptional personality as our chief guest today. I consider it as my honor to invite our chief guest to deliver the convocation address.
Namaskar. President sir and Director sir and all dignitaries on the dais. The most important people of the day, the new graduates. Such a privilege and honor to be with you all. Director sir asked me to give you a couple of advices, sir. Sorry. What I'm going to do is to make some requests, not advices. I am going to make a request to you all as your patient tomorrow. The day will come. I, like anybody else, have only 10% chance of dying a sudden death. Even then, even if I'm lucky enough to fall into that 10%, not being ill till then really is not an option. I will be your patient. I hope I'll be treated by one of you, because you have had the good fortune to graduate from an institution like this, one of the best few in the country. So, as your patient, I have a few requests to make to you. The first, to all the allied health sciences people, the genetic counseling, the audio, anesthesia technologists, everybody, laboratory technologists, please bear with me, because tomorrow, though I today recognize the importance of the work, you will make the difference between life and death for me. But my gratitude may be expressed only to the nurses and the doctors, because you are always behind the scene. I know what it feels like. To a smaller extent, as an anesthetist, I know what it feels like to be in the backstage. But please know that many people like me would be thankful to you. We recognize the importance of your work, and my best wishes to you for finding enjoyment in your work. To the Masters of Public Health, I specifically have a request. I think you are going to rule the healthcare scene tomorrow. Today, healthcare is not governed by you, and that I think is a problem. Today, healthcare is seen as disease control, disease treatment. Oh, I know, the Universal Health Coverage document, which we all quote and then forget, says that healthcare has to be preventive, promotive, curative, rehabilitative, and palliative. That's all in the books. Where would 95% of the money go? To the curative treatment. Promotive treatment, promoting health. Please, Masters of Public Health, bring out a healthcare system tomorrow. You can do it. Only you can do it. That will provide truly healthcare. Everybody here has learned the definition of health and promptly forgotten. Health, my health tomorrow, your patient, helpless patient lying in that bed. All my degrees and all the awards that you kindly mentioned will not have any relevance. Even if you bring all those awards and hang in front of me, I'm not even going to take a look at it. Even if I by that time own a Mercedes, which is very, 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 very unlikely, it will be of no use, because I will be riding only in an ambulance. What would be my health at that point of time? The definition that we choose to forget: physical, social, and mental well-being. How much of the public health that you see being practiced looks after mental well-being? We give speeches about social determinants of health. What do we do about it? Congratulations on all those publications. Oh my God, 1064 or something. Amazing. But if you ever enter that the portal of WHO in Geneva, you will see a streamer going through the screens. 86% of all published medical literature is never translated to action. 86%. 86%. You do it, you make the finding and forget about it later. I hope whatever amazing discoveries you have made, the conclusions from those findings, you will make it your priority, if you believe in it truly, to translate it to implementation research for the future. Get it across to me, because your paper, your research is of no value unless I, helplessly lying in that bed, unable to move, unless I can benefit from it. How long will you take, Masters of Public Health, to change the healthcare world? I cannot wait long, very long. At this age, I can see it almost happening over there. Please be fast. Change the healthcare scene. Make it truly healthcare. Aim for my physical, social, and mental well-being. I'm a palliative care doctor. Palliative care will convey different things to a lot of people. For a lot of people, it's care for the dying. Oh my God, yes, I do want support when I am dying, but if I have 1 month or 1 year from the time of diagnosis, from the time of onset of symptoms, till I die, I want life. I want your help to pack as much of life into that time as possible. Yesterday, over dinner, our director sir was talking about his specialty, hepatology, and the role of albumin in terminal hepatic disease. Listen, if I have an advanced hepatic disease which is not curable, and if I am on my way, what benefit will that albumin do for me? Except that remaining year or that remaining day for me to keep thinking, oh my God, I did not earn a lot of money in my life. I have destroyed my family as I am going. Every single bottle of albumin, useless albumin that he infused into a dying patient with that hepatic disease that he was complaining about. Thank you for your humanity, sir, for thinking about that, thinking from my point of view tomorrow. These are medical absurdities. What are you doing? You are treating the serum proteins. You are not treating me. You are forgetting me and treating my serum chemistry. Chemistry is important, but I am more important as a human being. Masters of Public Health, please change that also. Change the focus to the person, from organs, from chemistry, from microbes, from diseases to human beings. And fast enough for me to enjoy the benefit. One more ask to the public health people. Yesterday again, the conversation turned to what kind of diseases deserve palliative care. And Director Sir was arguing that it should certainly include hepatology. As a matter of fact, hepatobiliary diseases account for almost 5% of the global palliative care needs. Often forgotten. See, there is none of you will discriminate in the name of religion, caste, or creed when you treat somebody, but there is a curious caste system. Some diseases are upper caste. If I am unlucky enough to have that hepatic disease or reversed dementia, I fear that a palliative care system in this country may reject me, saying, oh, sorry, you are not lucky enough to have cancer. You are of the lower caste. You don't deserve it. How can we ever justify this? A discrimination in the name of a diagnosis? It's my suffering that should matter. Palliative care is mitigation of serious health-related suffering. And if you suspect that whether it's your duty, just Google for healthcare providers' duty of care, which has been officially defined by a statutory body of Government of India, the Indian Council of Medical Research. And they define the duty of the healthcare provider as the duty of healthcare providers to mitigate suffering. It is to mitigate suffering, and there exists no exception to this rule. I am quoting verbatim. There exists no exception to this rule. I am not asking a favor. I am asking you to do your duty of mitigating my suffering. Just 2 or 3 small requests, Masters of Public Health. Now I have to talk to the nursing graduates. Please don't be angry with me. I really consider nursing the noblest profession in the whole world. I hope you won't see it as chamchagiri for me to get some special favors when I am in that bed. But as you all came here to receive your degrees, I think only about 10% of the graduates found it difficult to smile. I found a smile in at least 90% of faces. Oh, not statistically. Biostatistics graduates, please bear with me. But I hope you will study this. The influence of a smile on the healthcare provider, on a recipient of healthcare. About that 10%, most of them, it would have been just stage fright. Maybe, I hope it is. I hope it is not sheer inability to smile. Those who smiled, when you find your videos, please give attention to the grade of your smile. I grade it in a grade of 1 to 5. 0 is no smile. 1 is the toothless smile. Grade 5 is all 32 teeth visible. And that smile reaches the eyes, not a mechanical smile. Do you think it's important in health when I am in that bed? Think from my point of view as the occupant of that bed. I particularly have fear. One more question to our physiology professors and biostatistics people. I don't know if this has been proved, but it's only observation, subject to bias. I have this feeling that the more degrees you get, the muscle tone increases. And the negative effect that increase in muscle tone is that smile stops. You stop smiling when you leave home in the morning. And your voice changes. How are you? It's intimidating. And then what will I say? I'm fine, sir. I'm fine, madam. You won't get to hear what I feel. You won't know my fears, anxieties, my pain, even my pain, because I'm afraid to talk to you. Once I was as the bystander in a hospital for a short time. You know, this bystander is an Indian phenomenon. I have not heard that term used anywhere else in the world. That's generally coming from traditionally our government hospitals. In the olden days, there were hardly any private hospitals. And for about 5 patients, there would be one stool with 3 legs on which the bystanders can take turns and sit down. So when I was being a bystander, I saw this scene. 2 people came in. One was obviously a senior nurse, must be very senior, with that muscular rigidity. Behind her was a young girl. I don't know whether she was a student or a new nurse, and she was carrying that tray. And this man on the bed had just been out of the ICU, had been delirious, was shaking and very, very distressed. So the senior person came in, held him like this, said, "Open your mouth and be still." The thermometer went in. The other things, vitals were taken. And then the machine, that human machine, turned and walked away. And the young girl just looked at the man for a second. And then, I don't know, her humanity had not been killed yet. She held his cheek like this. What a difference between that holding and this. And asked him, okay, in Malayalam, Yendacha, something like, what is it, Dad? There's obvious sufferings. That was the height of empathy that I have seen. Then she immediately picked up the tray and ran behind the machine. But in that moment, she was displaying the humanity. And as I watched, as the bystander, I was praying, when my time comes, I hope I will find a human being like that. The people sitting up here in front will be mostly teaching nurses. I hope you will not be afraid to sit up beside a patient. Sit beside a patient, smile at a patient, and show it to your students what humanity is. I hope you will not lose your smile. I hope you will maintain them and show them how a person in that bed, restless, can be made at peace, a little bit at least. There was a rather well-known former editor of New York Times, not a medical person, Anatole Breuer. Anatole Breuer became ill, and from what he wrote from the sick bed were very profound things. One of them is he's writing to his healthcare providers, I wouldn't demand a lot of your time. I just wish you would give me your whole mind just once. Not only your thermometer and blood pressure apparatus, your whole mind. See me as a person, as a human being. And that would make a lot of difference to me. When, okay, as an anesthetist, I am rather partial to anesthesia technology people. When I come into an operation theater, in spite of my life as an anesthetist, I am likely to be scared. I have also been depersonalized into a hospital gown. I don't exist anymore. I am just a body on a trolley. And as I am rolled into the theater, I will be scared stiff. And if at that point of time you touch my hand and tell me, I am here to look after you. Imagine the extent of peace that one sentence can happen. In this strange world, there is one person who cares for me. So I hope whatever your profession is, even if you are in front of me only to draw a blood sample, please see me as a human being and treat me as you, a human being. And if on some days your work is not too busy, I hope you won't mind sitting down beside me. It was already mentioned, the effect of standing up, looking down and talking. And if you will sit down beside me, look me in the eye, connect with me as a person, imagine how much better I'll feel. A Canadian psychiatrist, Harvey Chochinov, he's called the father of dignity therapy, talks about the importance of dignity. Now I am talking only, almost done, I'll finish soon. This is about the end of life. When I am at that point of time, I feel you will reject me. Terminally ill, nothing to be done. All the organs are gone. So what's there left? What there is left is the human being who is never seen in hospitals usually. And that human being matters. That human being matters even if that person has only 1 hour to live or 5 minutes to live. Because he or she is not dead yet. It's a life, and that life needs to be respected. And at that time, I think you should get to know me. Know me as a person. Chochinov writes this: treating a patient's severe arthritis and not knowing his or her core identity as a musician, providing care to a woman with metastatic breast cancer and not knowing she is the sole carer for 2 young children, attempting to support a dying patient and not knowing he or she is devoutly religious. Each of these scenarios is equivalent to attempting to operate in the dark. When the power is gone, if you perform a surgery, it will be something like this. This is not only about patients. This is equally relevant when you go home and meet your grandparents or elderly parents. What happens? You are busy. You go there to see them out of duty. Most of the time, your eyes are fixed on a device. And then you go in and say, Grandma, how are you? Grandpa, how are you? Bye. Just sit down with them. Make that gift. It will be good practice for your medical health profession. Sit down with them. Maybe you don't know them yet. Just sit down with them and say, Grandpa, tell me your story. Tell me about your childhood. And as stories emerge, you will make amazing discoveries. Once you do it to your parents, then you will discover that you really did not know your dad or mom. And this discovering people within people is vital if you are to treat them with respect and dignity. And that final message is this: I deserve and demand respect from you. Not for my degrees, not for the awards, not for anything else, because I am a human being. Like the 7.8 million people. He said 7.8 million people and then remembered that biostatistics people are there. Sorry if I'm very bad at my numbers. But like any one of those human beings, I deserve the respect that every human being owes to somebody else, because I don't know you. I know we got introduced this morning, but I have forgotten. I'm sorry. I don't know you, but I know that you have something in me that I do not have. Maybe you can sing, maybe you can dance, maybe you are intellectually so much higher than me. Or when I look at the humblest and the poorest patients in the ward, I know that they have had such hard lives. I know that I cannot have 1/10 of their courage to meet with them. And you just make an assumption that even at that time, I have something in me that you may not have. And therefore, treat me with respect. When you undress me for a procedure, please ensure privacy. You may think that it is not important for a very elderly dying person, but it matters. Ensure privacy. Give me your ear and assure me of confidentiality even at that time. And please treat me with respect. And with those requests, as your patient tomorrow, I congratulate you on this day of celebration. Forget about all this and go out and celebrate. Best wishes to you. My best wishes for your enjoyment of your profession. May you, very few people have that privilege. You have a profession that you may get to enjoy. Thank you for listening to me patiently, and once more, best wishes to you all.